Hello, everyone. I'm Dr. Aparna Chakravarty, a pediatrician trained in infectious diseases working at Amrita Hospital, Faridabad, the largest private sector hospital in India. As a clinician, medical teacher, and researcher, I'm honored to be part of WomenLift Health, a platform that has empowered me to take my leadership journey forward. Antimicrobials are a community resource, yet antimicrobial resistance is rapidly rendering them ineffective. The WHO identifies antimicrobial stewardship as a critical strategy to preserve antibiotic efficacy. Antimicrobial stewardship ensures that antimicrobials are used correctly, that is, the right choice of antibiotic is used at the right dose, right route, and right duration. However, antimicrobial stewardship programs largely focus on physicians, microbiologists, and clinical pharmacists, excluding nurses despite their frontline role in patient care. This gap presents a missed opportunity to strengthen antimicrobial stewardship practices and improve patient outcome. My vision is to empower nurses as antimicrobial stewards, ensuring they play an active role in antimicrobial stewardship. This transformation requires a structured approach through education, engagement, and policy modifications. Nursing has been a predominant female profession, therefore, thereby empowering nurses in antimicrobial stewardship aligns with gender equity in healthcare leadership. My journey with WomenLift Health has been instrumental in making this vision a reality. To understand the existing gaps, I conducted a situational analysis using a mixed method approach in the phase one of my project. These included focus group discussions and stakeholder interviews. I've conducted focus group discussions with 85 nurses from 8 hospital units, including the intensive care, internal medicine, pediatrics, and transplant wards. The findings from focus group discussions were eye-opening. While many nurses understood the dangers of antimicrobial resistance, they lacked familiarity with antimicrobial stewardship and did not see themselves as antimicrobial stewards. Through these discussions, we identified 5 key themes for nurses as antimicrobial stewards, which were safe medication administration, effective communication with the healthcare team, patient and caregiver education, continuous self training, and advocating for responsible antimicrobial use. These insights formed the foundation for the next phases of my project, which are developing and implementing a bedside antimicrobial stewardship bundle and structured nurse training curriculum to enhance their engagement in antimicrobial stewardship. The project is gaining a strong institutional support. I'm happy to share the messages from our medical director, Dr. Sanjeev Singh, who stated that nurses are the backbone of patient care, but have been excluded from the antimicrobial stewardship despite being in the front line. By integrating nurses into antimicrobial stewardship, we are not just improving antimicrobial practices, but driving systemic change. Our nursing director, Ms. Maria, also stated that by integrating nurses into antimicrobial stewardship programs, healthcare systems can enhance patient outcomes because nurses play a critical role in monitoring patient conditions, administering medications, and educating families about proper antibiotic use. With this momentum, I'm now focused on scaling the project, expanding the antimicrobial training, antimicrobial stewardship training hospital-wide, integrating into nursing curricula, and developing regional workshops and e-learning modules. The expected outcome include institutional impact by improving antibiotic monitoring and adherence. There will be community impact with patient and caregivers awareness and help reduce self-medication and antibiotic misuse, and at a societal impact by large by and will contribute to national and global efforts against AMR. My leadership journey has been one of immense learning and transformation from within. Throughout this project, I have strengthened my ability to lead change, engage stakeholders, and advocate. I have learned that leadership is not just about expertise, but also about collaboration, resilience, and a commitment to systemic change. I am deeply grateful to my mentor, Dr. Reenu Swaroop, for her guidance and belief in my vision, my coach, Ms. Sarita Gadgil, who provided invaluable insights, and the entire WomenLift Health team and my 2024 peer cohort members for their constant support and encouragement. I will end with a closing thought that when women lead, healthcare transforms and communities thrive. Thank you for your time.